Yeah, so the SURTAVI trial for the first time presented its 5-year outcome and echocardiography data. And SURTAVI is a randomized trial evaluating TAVI or TAVR with a supraannular self-expanding device versus surgery in patients at intermediate operative risk. And it was quite a big trial. So over 1,600 patients were randomized 1-to-1 in a modified intention to treat analysis. So basically in this analysis, every patient where there was an attempted implantation or procedure according to the assigned treatment strategy was included in the study. And in general, the mean age was approximately 80 years old. The STS score was 4.5. And what we saw was that there was no difference whatsoever at 5 years in the primary composite endpoint of all-cause mortality and disabling stroke. And then, you know, as expected, if you look then at the valve performance, hemodynamic performance of the TAVI valve was superior to surgery. And on the other hand, there was more paravalvular leak with the TAVI valve. But we have to bear in mind that the device that was used in the TAVI arm was the core valve in 84% of the cases. So that is an early generation self-expanding supraannular functioning valve. So I think the main message is that SURTAVI is very reassuring to select TAVI as a treatment in intermediate risk patients who are somewhat younger and also are obviously at lower risk. And basically by selecting a TAVI strategy, patients will do well and will do at least as good as surgery out to 5 years. So there are no penalties to pay for a strategy selection for TAVI over surgery. Yeah, well, I think, you know, in this day and age, you also have to bring the patient into the discussion, right? This is called shared decision making. And so you have to inform your patient about the less invasive option, which is TAVI, and then a more invasive option, which is surgery. And at the end of the day, based on SURTAVI, well, we are now able to say that at least out to 5 years, there is no difference whatsoever in clinical outcomes. So I think for the future, well, basically the current guidelines already pencil the future for us, because the current guidelines basically in Europe and in the United States already make the recommendation that TAVI is an okay treatment for patients above 75 years old, regardless of the risk profile. So basically the low risk trials that only have a follow-up of 1 to 2 years have already entered the guideline recommendations. But I think what SURTAVI now brings us is scientific backbone to that recommendation, because it's very important to know that there is no durability issue with TAVI, at least with the self-expanding supraannular functioning device.